Hello students, welcome to Life Sciences with Jyothisrii. In this module, we will be discussing about the pathophysiology of typhoid. Typhoid is the result of infection caused by Salmonella typhi and clinically characterized by continuous fever for 3 to 4 weeks and with the involvement of intestinal lymphoid tissues, reticular endothelial system and gallbladder. Enteric fever includes both the typhoid and paratyphoid fever and mostly found in human beings. It is a food waterborne disease, and the bacteria deposited in water or food by the human carrier and they spread to other people. And we have discussed in the previous slide that the causative microorganism for typhoid is Salmonella typhi, and it belongs to Enterobacteria family, and it is a gram-negative bacilli, and it shows best growth at 37 degrees Celsius, and it is facultative to aerobic bacteria with non-spore forming bacteria that is motile due to its Petricus flagella. And coming to the antigenic structure of Salmonella, there are two sets of antigens, somatic or O antigen with a long polysaccharide chain, and flagella or H antigen, which are very strongly immunogenic. Coming to the transmission or as the source of infection, the primary sources includes the fecal material and as well as urine of cases and the carriers, and fecal carriers are more frequent than urinary carriers. Coming to the secondary sources includes contaminated water, food, fingers, flies and as well as cockroaches. Next, is typhoid contagious? Yes, typhoid is very contagious and contacted by the ingestion of the bacteria in the contaminated food or water. Patients with acute illness can contaminate the surrounding water supply through infected stools, which contain a high concentration of bacteria. It does not spread through cough or by touching. Next, how do people get typhoid fever? Yes, work in or a travel to area where typhoid fever is endemic and work as a clinical microbiologist handling Salmonella typhi bacteria and having a close contact with someone who is infected or has recently been infected with typhoid fever and drinking contaminated water by the sewage that contains Salmonella typhi. Next, what are the symptoms of typhoid fever? There are several symptoms of typhoid fever, which includes fever for 10 to 15 days, and and as well as the incubation period is also for 10 to 14 days, and symptoms include are often non-specific and clinically non-distinguishable from other and febrile diseases. However, clinical severity varies and the severe cases may lead to serious complications or even may cause death. And coming to the uh, pathogenicity and as well as the mode of transmission, how the bacteria causes disease, we will be learning in this slide, that is the by ingestion of contaminated food or water that contains salmonella bacteria and invade the small intestine and enter the bloodstream, and the next is the bloodstream carried by these bacteria that is carried by the white blood cells in the liver, spleen and bone marrow, and the bacteria multiply and re-enter and the bacteria multiply in the bloodstream, and the bacteria will invade the gallbladder, biliary system and as well as lymphatic tissue of the bowel and multiply in higher number, and then they pass into the intestinal tract and can be identified by diagnosis in culture from the stool tested in the laboratory. So this is how the bacteria invades the intestine of the host organism, and Coming to the symptoms, what we have already discussed in the previous slide, that is a typical fever, abdominal pain, and it may vary from one patient to another patient. And mainly, the disease is transmitted by fecal oral route or urine oral routes, either directly through hands soiled with the fecal or urine of cases or the carriers, or indirectly by ingestion of contaminated water, milk, food, or through flies. Now, if we discuss with the clinical features of typhoid, during the first week, headache, cough, and sore throat in prodromal stage, and the disease classically presents with the step ladder fashion rise in temperature, and it occurs for 4 to 5 days, and combined with nausea, abdominal pain, constipation, and pee, so diarrhea. Next, in the second week, between 7 to 14th day of the illness, mild hepatosmelogomy occurs in the majority of patients, and may also rose spots may be observed. And in the third week, patients will appear in a typhoid state, which is a state of prolonged apathy and delirium, disorientation, or else coma. And diarrhea will become apparent if left untreated, and there is a high risk for 5 to 10 percentage of intestinal hemorrhage or perforation. Rare complications includes hepatitis, pneumonia, nephritis, osteomyelitis, and myocarditis, and 2 to 5 percentage patients may become gallbladder carriers. So these are the clinical features of typhoid. Next, coming to the diagnosis and investigation, which includes a blood culture, specific serological test, which identify the Salmonella antibodies as well as antigens, and urine and stool culture in during the second and the third week of the infection, and marrow culture and as well as punch biopsy samples of rose spot cultures, and it is 63% sensitive, and clot culture. So, but a serological test is performed. This is the perfect test for diagnosis of typhoid, that is the viral test. This test measures the capacity of antibodies against long chain lipopolysaccharides and flagella in the serum of individuals with suspected typhoid fever to agglutinate cells of Salmonella Typhi. And the main principle lying behind viral test is that if homologous antibodies is present in a patient's serum, it will react with respect to antigens and in the reagent, and in respect to antigens present in the reagent, and our visible clumping is present on the test card and agglutination in the test tube. So the antigens used here are antigen H, that is your flagella antigen, and antigen somatic antigen O. So, and as well as antigen H for Salmonella paratyphi. And so if we observe the actual viral test, as we have already discussed in the previous slide, that there are two sets of antigens, and these are used for serotyping detection for typhoid fever, which includes a somatic or O antigen, which contains a long polysaccharide chain and it is heat stable, and flagella or H antigen, they are strongly immunogenic and induces antibody formation rapidly and in high titer following infection or immunization. The flagella antigen is of a dual nature, occurring in one of the two phases. So here you can see the blue stained antigen are specific to O antigen, that is the somatic antigen, and red are specific to H antigen, that is the flagella antigen. Now let us discuss the treatment for typhoid, which includes continuous medical care with antibiotics, steroids, and antipyretics. And diet should be continuous fluids with electrolytes should be monitored, and soft digestible diet is preferable in absence of abdominal in distension and ileus. So surgical care if required. Next, coming to the antibiotics that are generally used for typhoid is for the treatment of fever. Prior to the use of antibiotics and intravenous fluids, the fatality rate is 20 percentage, and death occurred from the overwhelming infection, pneumonia, intestinal bleeding, or intestinal perforation. So antibiotics and supportive care have reduced to the mortality rate to 1 to 2 percentage with appropriate antibiotic treatment therapy or therapy. There is a usually improvement within 1 to 2 days and recovery within 7 to 10 days. So several antibiotics are used, which include chloramfenicol, ampicillin, and the choice of antibiotics needs to be guided by identifying the geographic region where the organism was acquired and the results of cultures once available. So there are certain strains from South America show a significant resistance to some antibiotics. So depending upon the intensity of the bacterial infection on the host organism, different antibiotics are used, and the treatment should be continued for 14 days. So medical professionals have reported multi-drug resistance and use cultures to guide treatment. So prolonged antibiotics can treat the carrier state, which occurs in 3 to 5 percentage of the infected. And often removal of the gallbladder, the site of chronic infection, will cure the carrier state. So that is nothing but colostomy if required. So these are the different pathophysiology or and the treatment and diagnosis and treatment for typhoid fever. Thank you.